Hello and welcome to my channel Direct from Doctor. My name is Dr. Shanay and today I'll be continuing my series on diabetes. I already spoken so much on diabetes in my last 3 episodes, in my last 3 videos. If you can go back and check, you'll get a lot of information. How one gets diabetes, how one can control it, and what is the role of insulin, and what kind of diet you can follow. Everything I have discussed in detail in my last 3 videos. And today I'll be telling some of the complications of diabetes. In case somebody has a lot of, very high sugar level, say more than 250, 300, or such kind of a level of sugar or blood glucose level very high, if it is so, what kind of complications can occur in a person, and particularly in the older persons. In the younger persons, it slowly destroys the tissues, but in the older persons, it destroys the tissues very fast. So you see, the main problem with the diabetes mellitus I'm talking about, that is in case it's very high, the main complication is the high sugar level or the high glucose level destroys the blood vessels. Means actually it will be circulating the blood vessels and it destroys the blood vessels. So this is the main complication. So once the blood vessels are destroyed, particularly the microcirculation means inside the tissues, the small the blood vessels go on bifurcating, dividing, and ultimately they end up in the small capillaries, and that last kind of circulation is called as microcirculation. So microcirculation is vastly affected, and this can literally kill the cells and destroy the tissues. So what kind of complications will occur in case microcirculation is affected and if the blood circulation is not proper? Say the oxygen doesn't reach the tissues, then required nutrition does not reach the tissues. In that case, the tissues get destroyed. So I'll list a few common complications. I won't go into very much detail, but what is necessary for you to understand. Say number one, a person can have what is called as a diabetic retinopathy. Retinopathy means it affects the retina of the eyes. So the vision may be affected because the retina can get destroyed. So that can lead to retinopathy, and it may lead to permanent damage. A person may become blind. So there is a very high complication of diabetes in case the sugar goes up like anything, say 500, 600, abnormally high. So in that case, a person can have it. And this is retinopathy. It's not very common, but the thing is, if it happens, it's very scary. It's very, very difficult to treat. So that is number one complication. And secondly, the most common complication what we see in highly diabetic people is the diabetic foot, we call it as, or the ulcers within in the foot, in the toes or under surface of the foot, or wherever the damage occurs, because it occurs mainly in the feet, because the circulation tapers down in the extremities, in the fingers and toes. It comes down, and only capillaries are capable of supplying, and the blood. In case those capillaries are destroyed, the tissue gets destroyed. Means the tissue gets rotten, literally. So this is called as gangrene. So once the tissue gets rotten because of the cut of the blood supply, it undergoes necrosis. Necrosis means a death of the tissue. So that is very scary. So over that, if the bacteria grow, you can imagine the situation. It's very, very scary situation, and a gangrene may set in. So diabetics should always watch for these kind of signs, like ulcers in the foot. Ulcers, one ulcer, two or three. Say under surface of the foot, in case it occurs, it's quite difficult for you to see daily. So what you should do is, at least once in a month or 2 months, so sit in front of a big life-size mirror or big mirror, and hold your foot like this. So the under surface of the foot is reflected in the mirror. That way you can examine your foot. You can even put a bit of torch and all that, light on the foot and reflect it in the mirror, and examine your toes and undersurface of your toes and the feet for signs of any ulcer. In case you see an ulcer, and if it is not a healing ulcer, it does not heal for a long time, it may indicate that it may be going in for the gangrene. It may be, not 100% sure. So immediately you should rush to a doctor and have it examined. It's very, very important. Please don't forget. See, if the gangrene sets in, and if the person does not know, the gangrene can spread up. It can spread up. It can eat away the entire foot, entire leg, and the person may have to undergo amputation of the leg. Amputation means the leg may have to be removed to spread the further rotting of the tissues, further gangrene spreading inside the body. It can be really dangerous, right? So we have seen quite a few cases like that. So this is one of the scary pictures of complication of diabetes. So another complication is the damage to the heart. So a diabetic person is more prone or more susceptible for heart diseases, because the heart muscles can get destroyed, the blood vessels can get destroyed, can get damaged, and it may undergo sclerosis. Sclerosis means hardening, thickening. So that is called atherosclerosis. It comes by aging also, and because of some other factors also. But this is also one of the reasons, diabetes. So a person can have heart problems, so heart damage. The person can have a heart attack easily. So that's one more complication. And I say the kidneys. The kidneys can get damaged really fast in diabetic persons. If the person is really highly diabetic, if it is controlled diabetes, fine. If it is very highly diabetic, the circulation, microcirculation to the kidneys can affect, and kidneys can have the chronic disease called as chronic kidney, so we call it as a CKD, chronic kidney disease. That is a long-term kidney disease. Once the blood vessels are destroyed, the filtration capacity of the kidneys will reduce, and also creatinine will build up within your body. That's the reason diabetic people should also check for creatinine. Serum creatinine is better to check. So whenever you go for a checkup of sugar, get your creatinine also checked out to see if it's under control. If it's within say 1.4, it's fine, no problem, you need not worry. If it goes slightly up also, it's okay, but then it should not go too much up. That means creatinine is getting built up and it's not being filtered in the kidneys. So this one factor you have to see. So that is one more complication. Then a diabetic person can have the nerve damage. So nerves also can get damaged because of diabetes. So we call it as a diabetic neuropathy. So such kind of persons, particularly in the legs, they can have tingling sensations. It can start with the tingling sensations, and then later it can lead to a lot of other problems like more pain. A person may not be able to walk much. So these kind of problems may set in because of the neurological issues. So these are also some of the warning signs of diabetes. And also the person's thinking capacity can go down, and because the neurons, which neurotransmitters within the brain, they may get affected. So the person's coordination, the motor and sensory coordinations may go down, and the person may suffer from these kind of issues in the long term. So if the diabetes goes uncontrolled, if the diabetes is controlled, all these complications. See, diabetes is essentially a lifestyle disease. So if you modify your lifestyle, if you cut down on the sugar, if you completely give up sugar, and if you cut down on high glucose and high carbohydrate food, if you can cut down and increase more of proteins, half battle is won, and rest of it can be controlled with the medicines. So see, these are some of the complications. And one more complication, and according to our science, is diabetes are more prone for cancer. Hope you get it, because the sugar, they say it encourages the cell division, and so the cells will multiply too much in a particular area. It can lead to cancer. Cancer is nothing but abnormal multiplication of the cells, and it leads to the tumor. So the diabetic persons are more prone for cancer. And one more warning sign of diabetes is inside the mouth, the gums can have micro ulcers, small ulcers. So the diabetics are more prone for gum disease inside the mouth, and you can clearly, in case the diabetes is too much, there will be a bit of a problem, and sometimes visible problems like small ulcerations on the gums. So if you see those, please get tested by dentist, and also go for regular checkups to a physician if you see any other signs. So these are some of the warning signs and complications of high diabetes. There are certain more complications which can occur, which we will not discuss right now, because these are the common ones what I have discussed today. So these things one must know. So please tell about this to your elderly people at home, and if they are not got checked up, get them checked up for sugar levels. It's essential. And if one is having a diabetes, then almost a daily home checkup is necessary with a self-testing kit. All the best. So in the next video, I'll be covering some other issues. May not be diabetes, it is some of the health issues I'll talk about. I talked enough about diabetes, so please go to my earlier videos as well and please check them and have some knowledge about it. All the best. See you in the next video. Please subscribe and also share my channel. Thank you.